Hi, Fems. I am Violette Ayala. I'm the founder of FemCity, and you're joining me today for our Business for Your Soul show. We actually record this also for a podcast. I'm always really excited to get to learn from beautiful women in our communities and to learn, and hopefully it inspires you as well. Today, I'm really excited. We're going to mix it up a little bit and talk about something different besides just business. And I'm super excited to have with us today as our guest, Dr. Bindiya Gandhi. And I'm thrilled that she's here to share with us today her advice and expertise on how we can live life better. So thank you so much for joining us today.
Thanks for having me.
And can you share a little bit about your background for those that are just getting to know you for the first time?
Yes, thank you. So I am actually a double board certified doctor in family medicine as well as integrative medicine. So I practice integrative and functional medicine. It's kind of a different dynamic approach to wellness. My job is to get to the root cause of medical problems. I've been practicing this way for about 6 years. I'm the medical director at Revive Atlanta MD, which is in Decatur, Georgia. And again, our job is to kind of treat patients from a very holistic approach. My job is to keep people healthy and well and maybe take them off of medications. And we use different modalities like, nutrition, supplements, I incorporate Chinese medicine, Ayurvedic medicine. So it's completely different, but it works.
I love that. I know so many women in our communities are going to love getting to know you today and hearing your expertise. Because they're all craving that, especially now during these times where we're talking about immune systems, we're talking about how to boost our immune systems, how to be our best, healthiest selves during this pandemic, especially during this pandemic. And so I wanted to ask you, we talk about now with COVID-19 around, and now that's a common, obviously we're talking about it every day, all day long. What are some ways that we can, when it comes to health and things that we can do, what are ways that we can go ahead and start thinking about supporting the immune system?
Yeah, so that's a really great question. One of the things that I think everybody should start doing if they're not doing already is take some vitamin C. I think vitamin C is super important. Zinc as well. It's another supplement that I like. Vitamin C, vitamin D is another supplement. So vitamin D is probably the one supplement that if you take too much, you could potentially get toxic. Most people, though, are vitamin D deficient. So taking like a 5,000 international units a day is completely fine. But those are probably one of the top 3 supplements I'd have people take, even like just to keep your immune system like healthy all year round.
Okay, yeah, I'm vitamin D deficient. I've been like that for years. And I take my vitamin D and I'm like, I just wrote it down now. I'm wondering how much I'm actually taking and if it's even enough. But I just have a tendency of being deficient in that. I didn't realize how common it was.
So it's extremely common. And I'll tell you this, what I see in practice with vitamin D is people will take it for a little bit and then they stop taking it because they feel like they don't need to take it anymore. It takes a very, very long time to get your vitamin D up. 5,000 IUs is not a big dose. It's actually mediocre dose. When I know a patient is deficient, I'll actually put them on 50,000 IUs once a week. So really big, hefty doses to get that vitamin D up. Now, in all my years of practice, I haven't seen not one person get toxic by taking too much vitamin D. But I always like to caution that for a group of people, especially if you've got kidney issues, or if you all of a sudden decide that you're going to take way too much vitamin D, meaning you're going to take that 50,000 IUs like 3 weeks straight, then you could potentially get toxic.
Right. And I know this is not a question I had planned on asking you, but now that we're on the topic. So if someone's vitamin D deficient, they're always going to be like that, you think? I mean, they have to pretty much, or does it get better?
So here's the thing with vitamin D. There's a group of people, and I'm one of those people that genetically, we're not converting it from the sun, right? And so there's a large population of people that you're not able to convert it. So yeah, that means that I'm always going to have to be on some sort of vitamin D supplement. Now, when I stop my vitamin D supplement, my vitamin D will plummet. And I usually can tell when my vitamin D is low when I feel like I'm craving that afternoon nap, right? And I know my vitamin D level is better when I don't feel like I need that nap anymore. And that's my little trick. And that's kind of what I talk to patients and teach them to kind of start getting in tune with your body, because you'll know what supplements you need, or specifically like when you may need more vitamin D.
Yeah, I love that. I'm going to start doing that now. Now you say that, I'm going to totally start doing that. Because I am actually that person that you said that they start taking vitamin D and then they're like, oh, I feel better. And that's generally, I feel better. And then I stop and then I get my blood work done again. And then it's like, Violet, it's always a prescription, right? It's always like, you need to get back on it. So what are some other ways? I know that a lot of femmes are, we're all really nervous about getting COVID-19. I know now 12 people that have passed away from COVID-19. So for me, we're in Miami. It's definitely really real. What are some things that we can be doing, whether it's through practices like, wellness practices or vitamins or food that we're intaking? Like, what are some things that you think that we should really start taking on? I mean, you mentioned already the vitamin C, the zinc, and the vitamin D as well, which are huge. And I'm going to go ahead and buy those later on today. But what are some things that we should be doing in order to support our system so that we're not as susceptible to getting this? Or is there anything that we can do?
Honestly, the biggest thing that I'm going to recommend is, wearing a mask. I can't stress that enough. I think wearing a mask is so crucial and so important. Other than that, hand washing, social distancing, all that good stuff. I think you guys, everybody needs to do. But sleep is so important. People take that for granted. You need to make sure you're getting about 7 to 8 hours of good quality, restful sleep a night. Okay. What happens when you're not sleeping? It actually stresses your body and it stresses your immune system. So it makes you susceptible to getting sick. So sleep is very important. The other thing that I think is also really important is stress. We don't talk about this enough. Being in a pandemic, yes, we're all stressed. A lot of people are laid off right now. A lot of people have maybe loved ones that are sick or whatever, but that chronic stress definitely suppresses your immune system. And so those are probably the two things that we can actually work on. Obviously, eating well, trying to eat clean, making sure you're not eating a lot of sugar, processed foods, that kind of thing. That's also going to help your immune system. And getting moderate exercise will definitely help. Not anything high intensity. So marathon runners, if you're training for a marathon right now, no, not a good idea, because that suppresses and weakens your immune system. So there are definitely some things that you can do to stay healthy and keep your immune system happy right now.
I love those tips. The sleep one is a big one. The sleep one, I didn't realize how important sleep was until my youngest child started sleeping the night. And then I started sleeping for the first time. And that was just completely, I was able to have clarity and think properly. And the connection to the immune system is obviously, and thanks for mentioning about the mask also. I can't believe we're in Miami still. I cannot believe people are still walking around without a mask, like thinking that it's not. I'd not to go in that direction, because I know we're talking about the support system, but I'm so glad you mentioned that, because you're a professional. This is what you do, and that makes a huge difference. So, and washing your hands. I've washed my hands now. They're chafed most of the times because I'm washing them around the clock. I can't even imagine how you guys are doing it, because that's your everyday. You're washing your hands like 30, 40 times a day.
Yeah, we do. Yeah, it's so important, guys. Like, I mean, I think people take it for granted that I don't think people realize that this still exists if it hasn't hit home. If you don't know anyone that has coronavirus, you may think that it's just like on the TV or something, right? So, but it's real, guys, and it's important to just be safe.
Yeah, absolutely. I know today on Facebook, someone, one of our was on her podcast a couple months ago. She was in New York, and she posted this thread, like, put a heart and the state of where you know someone who's passed away from it. And for us, Florida, New York, and my husband does a lot of business in India, and he had and so we have friends that have passed away in India, and so for us, it's become it's been really real for a while. But I understand that if you're, you may not know anybody, and for you, it's not as important right now. But I think that the tips that you shared are wise tips for anyone to do actually throughout the year, like even regardless of pandemic. I mean, those are tips that we can all focus on our sleeping, focus on what we're eating. The sugar thing also. There's a connection, right? When you have more sugar, there's been a bigger connection to illness in general, correct?
Yeah. So there's certain risk factors that actually make that make you more susceptible to COVID. And if you have COVID, if you are exposed to COVID, you have a worse case. So obesity is definitely one. And then, and specifically having a body mass index greater than 25, which let me tell you that majority of my patients have a body mass index over 25, right?
Right.
That's just overweight. That's just being overweight. And then having a body mass index over 30 increases your risk. That being said, that's important. But then also diabetes. Diabetes is another big risk factor. So when you have diabetes or you're pre-diabetic or you're eating a lot of sugar, your body is trying to kind of deal with the diabetes, and that's what kind of stalls the um, COVID. It stalls the COVID from kind of getting better or whatever, slows the progression. So
Right.
that's why it's so important. If you have these risk factors, to stay home or not be out and about, and to know, okay, even more reason I've got to take care of myself, or even better now, let me work on some weight loss and let me work on how I can get off of these diabetes medications and so I can live healthier.
Absolutely. In my former life, I was a personal trainer and a Pilates instructor, and sugar, when I would train, sugar was the biggest. Like if my clients at the time would remove sugar from their diet, they would drop in weight significantly. So just sticking to like lean proteins and just like vegetables, like, whether it was cooked or sauteed or whatever, if it didn't have sugar, I always saw them decrease. So I think sugar, and that could be a whole other podcast conversation, but I think sugar is really just horrific. I was pre-diabetic a couple years ago, and I removed the sugar, and I feel so much better in so many ways. I'm sleeping better, and I haven't been as sick. I was getting sick all the time with respiratory infections, sinus infections, and walking pneumonia all the time, and that definitely has gone away. So
Yeah. And part of it is it's cultural, like our culture revolves around food, and we enjoy eating and that kind of thing. Holidays, there's always desserts, there's always something sweet, and summertime we want our ice cream. Like it is cultural, but you have to understand that sugar, and I hate saying this, sugar really is evil, and
yeah,
sugar really spans the virus, and it, it's bad. So that's one thing that you do cut out is sugar. And I also want to add alcohol, because alcohol is sugar. So people don't always correlate alcohol with sugar.
I love that. Yeah, I'm so glad you said that sugar is evil, because I think that all the time. Once I started seeing the differences in my own body when I removed the sugar, and I was able to get down to not being pre-diabetic anymore. I'm so excited about that. It's been a couple years since I've been in the normal range. I know, I'm so excited, because I was like, I do not want to be dependent on shots. I already have Hashimoto's, and I don't.
Yeah.
Between the two, I was like, I'm not. And by the way, I think there's a correlation between Hashimoto's and diabetes also. I think I read that somewhere. So interesting. Interesting. So any final tips that you have for those that are watching, that maybe not even just about the pandemic and COVID-19, but perhaps just wanting to be more healthy and to boost their immune system, whether they have Hashimoto's or deficient in vitamin D? Any other tips that you want to share with them?
One of the things that I think is so important is whenever you're trying to make any changes in life, and start off small. And get your family involved. Get your sister, your brother, your loved ones. Tell them what you want to do, and get an accountability partner. I think that's so important, because sometimes you want to make these changes. Like, for example, like you want to start working out, but it's like it's overwhelming. You don't know where to start. You don't know what kind of workouts to start and doing. So if you tell maybe your sister or a loved one, they can do it with you, or they can give you tips, or say, hey, why don't you talk to this personal trainer, and or whatever it is. Like, but don't feel like you're by yourself and there's no help out there. There is help out there, but you also have to be realistic and take baby steps. Like, no one's expecting you to make these like big changes overnight.
Yeah, I love that tip. I love that. When I was a personal trainer, I used to tell my students, it's not that I was teaching you guys something that was like, a never had been heard of before. It was more, I was just the accountability piece. Like, you paid for it, you showed up, you did the work. And so I love that idea of just, not that idea, that reminder, you can actually like reach out and have someone walk with you. Maybe you guys do a Zoom yoga class together. I know my daughter's been doing that a lot. You can download certain apps. I mean, there are things that you can do if you have somebody else. It also takes, I think, the anxiety away. Like, you feel like you're not alone, that you have somebody else doing it with you. So I love that. Thank you so much for taking time
you're
out
welcome.
today to join us. How can Femmes find you if they want to learn more about your practice or about you in general? Where could they find you?
Well, you can definitely find me at www.drbindiamd.com. My practice name is, or address is www.reviveatlmd.com. So that's reviveatlmd.com. And then you can also find us on Facebook at Revive ATLMD, at Dr. Bindiya MD on Instagram as well. So yeah, definitely come find us, say hi.
Awesome. That would be great. Well, I can't wait to start traveling again. Hopefully I can make it over in your direction, or you can make it down this way to Miami.
I
And
know.
hopefully soon, hopefully 2021. I've kind of given up for this year. 2021 is going to be the year that we can travel again, I think. So,
I
so
hope
grateful.
so.
Me too.
Yeah.
Me too. Thank you so much for joining us, and we'll be back next
Thank you
week.
so much. Thanks.
Bye.
Bye.